Hey guys, welcome back to Medical Coding with Blue. Okay, so a few things to cover on today's episode. We are mostly going to be talking about critical thinking skills for medical coders and why this is so important, but also just a few other couple things. So I will not be filming for Quiz Fridays anymore because historically those episodes have been viewed the lowest amount of times. So I'm trying to look at ways to maximize the time that I'm spending on YouTube on things that you all want to see and episodes that you need for you and your own development as coders. So I'm looking at those things. I'm testing the waters to see if different things will work. So just bear with me. I like to give you guys a choice, which is why I I did post a question, which I was very surprised to see 30 votes. I appreciate that, guys. Thank you so much, because it tells me what you guys actually want. Okay. Now, the next thing is, with today's episode, on the upcoming episode for Quiz Friday, I will be adding diagnoses that are not easy to find in the book. And some of them may be actually impossible to find. But I want to see if you guys can stretch yourselves in order to find these diagnoses, because this is very important. You're not always going to have everything cut and dry when it comes to finding diagnosis or seeing things in documentation. And you're going to get stuck on those ones where it's like, oh gosh, what do I do? Now, I'm going to cover this in the topic today, but I want to say this first. You're not going to have to memorize everything. What you do need is above everything else is to know how to find the answers. And you all have to learn how to do that. That is like the number one thing. That is what is really going to help you to understand what you're doing and to feel more confident in how to do things. Yes, you're a student maybe, or maybe you are just starting out in the medical coding field and this is your first job, or maybe you've been a coder for a while, maybe you're doing a new clinic. You have to know how to find the answers on your own. And then if you need help, then you need to reach out for help. Okay, don't be so stubborn that you can't find this stuff and you can't figure it out. You have to learn how to find these things on your own, because not everybody is always going to want to help either, okay? I don't mind helping because that is what I'm doing. That's the reason that I have this channel primarily, is to help other people to learn. But I'm also going to challenge you as well. I'm not just going to give you guys the answers, because I want you guys to be able to think and grow. That's the only way you're going to be able to grow. So if you're looking to come to me, hey, can you give me the answer? I'm not going to do that. I'm going to make sure that I challenge you so that you do learn how to find the answers. Yes, there are some times when things are going to be worded a little weird, and then you're going to have somebody explain it to you. I totally get that. But if you're looking just to come to me to say, hey, what is the answer? No, we can't do that. We're not going to do that. We need to grow and be better as medical coders, because giving you the answer is not going to help you in the future. You know that saying, if you teach a man to fish, or if you feed a man a fish, you feed him for a day. If you teach a man to fish, you feed him for a lifetime. It's the same principle, the same idea, okay? So at least I said that one right this time. You guys know me and my thing with sayings. So anyway, but I'm going to start out with Malcolm Forbes, who you all know, or hopefully you know, that he is the publisher for Forbes magazine. He said this: education's purpose is to replace an empty mind with an open one. So think about that. Every time you're educating yourself, every time you're putting more knowledge into your brain, every time you've experienced something new, your brain is taking all of this stuff in, okay? You have to maintain an open mind in order to get new information in. If you are closed-minded and you don't want to learn anything else, this is the wrong field for you, okay? You are going to continue to learn. Somebody even asked me, a viewer asked me, do I still have to keep studying after I get my certification? Heck yes. That's why we have our continuing education units that we have to report. This is a part of it. This is part of being a medical coder. And a lot of times when like schools are trying to sign you up, or people are trying to convince you to get into the field. Now, I will say this, I do not have a dog in this fight. I've never tried to sell medical coding to anybody. If you want to do it, do it. And if you really want to do it, I'm telling you now, these are all the things, all the videos, the 200 plus videos I have on my channel. These are all the things that are involved when it comes to medical coding. And so many times I've heard, oh, I didn't know all of this stuff was involved in it. Well, I'm glad you're doing your research, so now you know, you know, because I can't imagine starting in a field and not really knowing what's going on. Now, I went into this field on an accident. This field found me, and so now here we are over a decade later, and I'm still learning, and now I'm sharing because this is the stuff that I didn't get told when I first got started. So hopefully you guys learn from me. Hopefully we can all grow together as good medical coders, more detailed, specific coders, because the more specific and the more detailed you are, the more valuable you are going to be. Now, trust me, when you are competing against other people who have been in the same clinic and don't want to grow and don't want to stretch and just want to do the same thing that they're being told to, it's going to be a lot easier for you if you are able to find different things, if you are able to digest the information a lot better, and you can come up with an answer a lot quicker. It's going to be a lot better for you. Okay, so I have a list of things that I want to talk about for this one. So key critical thinking skills are analysis, interpretation, inference, and I think I said that right. Inference, there we go. Explanation, self-regulation, and open-mindedness and problem solving. So you ever hear me when I say I'm a problem solver, I solve problems? I look at things in an analytical point of view and I think, okay, what is the outcome if we went this way? What is the outcome if we went this way? What is the outcome if we went this way? I always try to look at the information that I have in front of me, whether it's looking at a document or anything, any problem solving thing I have to do in my own life. I always try to look 4 or 5 steps ahead to see which way is this going to go. That is problem solving, okay? You have to have that when you're a medical coder because we have to work so independently lots of times. And lots of times there's going to be people that don't want to help you because nobody helped them, which I find very annoying, but it does happen. So if you are around that, if you're around people that don't want to help you, it's fine. Come here, ask your question. But at the same time, I'm going to ask you, did you do your research? Have you gone to this site or that site? Or have you tried to look up in that specific specialty, what are the symptoms of that particular diagnosis? Okay, so it's going to be let's help each other, okay? Because there are some things that I've learned as well, especially when I do my research for my shows and things like that, because I try to give you guys as much good information as I possibly can. I try to make a lot of quality content for you guys so that you guys can learn something, okay? If you're here and you're listening, at least I know you're trying. So, but yes, you have to be willing to take that step and to be, you know, as hands-on as you possibly can be. If you don't understand something, dig and look and try to find out what you can. And use resources that are legit, okay? You want to go through the book. You want to use your Merck manual. I found my own personal Merck manual at Goodwill. Use things like the Coder Desk reference for diagnosis or the Coder Desk reference for procedures so that you understand what you're reporting and what is going on, okay? What are the symptoms? The Merck manual will help you with that. If you are working with an encoder, there's a whole little section for reference, okay? Hit Google and say, I'm looking for this code or that code and see where it takes you, okay? And so that way you can sort of get some direction, okay? So that has to happen sometimes. I've done it before, so there's no harm in it, okay? So the next one is challenge just being told how to code. Yes, take guidance, but really look and understand why you are selecting the diagnosis and procedure. Okay, so here's a little story time for you. Couple story times. First one is I knew a provider who worked in my section. I'm not going to say what specialty because it's going to kind of narrow it down. But I knew him. He worked in my section, and I had the partner at the time, and we both worked on his stuff, okay? And he came in there, you know, just very upset and very mad, and he wanted to know why his numbers were falling and why he was not getting credit for all of these high levels like he thought he deserved credit for. So keep in mind, at the time, it was me and my partner, and we would rotate the weeks, okay? So she would have him for 2 weeks, and I'd have him the second 2 weeks. So every 2 weeks, he would have a new coder, or it would just be us trading off. And I would code his stuff, and then she would code his stuff, and then I would code his stuff. So instead of having one coder do it, which eventually now that's the way it is, but at the time it was not. They felt it was more fair if we were rotating. Anyway, he was very upset because he could run a report to see what diagnoses and what procedures were being picked up. And when he saw, for my weeks in particular, that I did not give him all these high levels like he thought he deserved, he was very upset and he wanted to know why. The documentation is not there. Well, you are going to report this. You will do this. And I said, no, I will not. If it is not there, if it is not supported, I am not going to report it. If you want to improve your documentation, like we've been trying to help you to improve your documentation, then that would be something that would be different. Well, then my boss had to step in because he called her in, which was fine because I was in the right. There was no saying that I was wrong when he's trying to get a higher level and there's nothing to support a higher level. And a higher level meaning a level 5. You're not going to get it, especially when I can see in your documentation that you don't have anything to support such a level. And I had been dropping a lot of his levels down to levels 2, 99212, because he did not have enough information there. His documentation was insufficient. Well, of course, again, there's that unequalness in the quality of the coding. My partner was not as detailed as I was, okay? So whatever she did, that was on her. For me, I was making sure that I used the evaluation and management tool, that I went through and I looked at all of the things that needed to be looked at. If he was not documenting in such a way that was supporting what he was selecting or the procedure code that he wanted or the E&M level that he wanted, he was not getting it. So needless to say, I was public enemy number 1 for him, and that's fine because you will not try to bully me into giving you whatever code that it is you want. Okay, so eventually it worked itself out. I didn't have to work with him anymore after that, and he was somebody else's issue. But at the same time, if it's not right, it's not right. And so I refuse to do things that are incorrect. I wasn't ugly about it, but he was not used to being told no. Okay, so this may happen when you see this in your facility. This may happen. He has gone on to another facility now, so somebody else has to deal with him naturally. This is something that may happen in your facility, and if it does, you need to stand firm and you need to stand your ground. You need to have all of your references, and you need to have like official guidance backing you up. Because if you have official guidance backing you up, it does not matter who's disagreeing with you because it's all right there, especially if you're following the rules. Now, if your interpretation of the rules is different from what the book actually says, that's something different as well. You have to have the same interpretation as what the books say. Ethically, we are all bound to follow these rules. Okay, this is very important. You have to do this. Okay. Another situation I had, let's see, how can I say this? All right, so I was doing the pulmonary clinic, and I was brought in to help the pulmonary clinic because the pulmonary clinic was having a hard time capturing what was going on with their clinic, and they were losing a lot of money. They were like, we don't know what's happening, what's going on. You know, is this a coding issue or whatever? What are we doing here? So I was looking at all the procedures that they were reporting versus what they were documenting. Okay, and one of the procedures that they were trying to select was not supported in the documentation, so I pulled it out. Well, A supervisor, I'm not going to say which one, but a supervisor of mine did say that, no, Blue, that's incorrect. You need to report this other procedure. I said, nope, it's not there. And she said, yes, it is. I said, no, it isn't. And so I went to the people who actually administered that test for pulmonary, and I asked them to please describe it to me, because I had seen it, and I had seen that they had selected that particular procedure code, but I saw that they were not. It was not documented appropriately that it could justify the use of that code. So I asked them, "What are you doing here? What does this code mean to you?" Well, as it turns out, they had misinterpreted the meaning of that code, which there's a lot of procedure codes in pulmonary, and a lot of them sort of kind of run together. So they were saying that, yes, we're doing this. And I said, okay, describe it to me. So they were describing it to me, and I showed them how it was a whole different procedure, not this procedure code that they were reporting. And they go, oh, okay. They go, well, that makes sense. Well, that cleared up the air between me and the clinic. Well, of course, here comes a supervisor asking, Blue, I asked you to report this procedure code, and why aren't you reporting it? Because it is not there. You will report it. Oh, no, I will not. Here we go. So I had all of my documentation. I had the book, and I had a reference from the American Lung Association. I also had a letter from the clinic, what the nurse that was actually doing it, and one of the other providers that was actually performing it as well. I had a letter from them. I took it all to her, and I said, here you go. She goes, oh. I said, yeah. It's easy to misinterpret what's going on in this procedure code because that's the way that it's looking. However, if you look at what the requirements are, it's not being documented. And why is it not being documented? Because it didn't happen. That's not what they're doing here. So just going along to get along would not have benefited anybody in this situation. I refused because I did not see it there. And I refuse to code something wrong just because you tell me to code it this way. If I don't see it, if it's not there, if it's not supported, I'm not going to pick it up. And I'm not doing it just to be argumentative. Please, far from it. But what I am doing is making sure that that provider is getting all the appropriate credit that they are entitled to. And because of me, everything went up. So sometimes what you say may not be the most popular. I'm just saying. But if it is, then you know you're doing it right. Okay, obviously you can do things and not be argumentative about it. You can show and support your argument. If somebody's trying to teach you, it's fine. Listen to them as long as they have a official guidance. Don't just listen to, well, I do it this way. No. Understand what they're doing, why they're doing it, and what is their official reference. There's nothing wrong with questioning, okay? I'm just saying. So make sure that you are really looking at it. The best way that I can tell you to be more sharper with your clinic or your clinics is to specifically look at references for those clinics. When I got put in the pulmonary clinic, the first place that I went was to the American Lung Association to see what I could learn from there. Then I got a coder's desk reference for procedures, or a coder's desk reference, coding companion. I got the coding companion for ENT, for ear, nose, and throat, and allergy. So that was all your lung procedures in that one. And I looked over that book. I didn't read every single detail, but I did skim over it so that in my mind, the way that I was looking at it, my brain could actually look at what was going on, because it does help with memory recall when you're just looking at the pages, because eventually you're going to think about it again and you're going to be like, oh, I remember I saw that somewhere. Where did I see it? And then you can go back and look in that section. And always review the section of the CPT book if for that particular specialty if you are coding in the outpatient setting. If you're coding in the PCS, that's something completely different. It's a whole different animal. I'm just talking about the outpatient setting right now. So if you are unfamiliar with your CPT book, or if you say, oh, Blue, I always use the encoder, I don't have to use the CPT book. Use your CPT book. Stay familiar with it, especially if you are planning to take additional credential certification exams. You will not be able to use an encoder. You have to be able to maintain your speed, okay? So that's my bit of advice on that one. Okay, Anna says, I covered that one about not memorizing, okay. And if you take, the next thing is, if you take everything that people say at face value, this will not help you to learn. If somebody's just giving you the answer, this is not going to help you. Because yeah, while you may learn it, you may not know why that is the correct answer. Why is it that they say to do this? Or why did they say to do that? It's better if you sit there and try to understand why. Okay? Always ask questions. Because again, if you write me and you ask me, yes, I do answer emails. However, I will ask you questions before I just say, well, this is how you get to this answer, okay? And if I feel like you're just looking for the answer, then I'm probably not going to respond, okay? Or I will respond but let you know that you need to look up the answer, help me out here, and then I can point you in the correct direction, okay? So that's the reasoning on that one, okay? The next one is exercising critical thinking makes you sharper and more in demand. The best medical coders know how to question and solve problems. You have to be able to teach yourself how to do that. Question everything. Question the provider if they've selected all these diagnoses that don't make sense versus whatever they're documenting. Talk to them and ask them why. What's going on here? If you don't have access to your doctors, if you're just coding and it's not your place to work with the doctors, and that's fine. Work with whoever's supposed to work with those doctors and ask them, why do they select these wrong diagnoses, or why are they doing this, or why are they doing that? Because not everybody knows and understands the proper way to select diagnosis. Again, I have seen providers who the patient was injured and they come in and they say, I have wrist pain. Well, why do you have wrist pain? Because I was in a fight and I need to go check it and see if it's broken or sprained or whatever. And they'll select wrist pain. No, sir. The patient came in with an injury. Well, Blue, I don't know if it's fractured. I don't know if it's a sprain or not. Well, then you tell me that it's an injury, and you can say it's an unspecified injury of the wrist, but you will tell me that it is an injury, or you will select that diagnosis code, not the pain. Pain is an organic condition. That's like you just woke up and like, hey, like I'm in pain. That pain is a byproduct of that injury. So why are they in pain? Because they were injured. That's the code that should be selected. So again, think about those things. Remember what I'm saying. If you remember anything that I'm telling you, always look at what is being selected, what is being documented, and is it supported? That is the number one thing, is it supported? Okay. And then number 7, the last one is think for yourself. Use resources like the Merck Manual, the Coder's Desk Reference for diagnosis and procedures. Think for yourselves, okay? Think for yourselves. You have to be able to find answers on your own, all right? I do ask only one person for coding advice or anything like that, because I try to keep who I ask to a very clean level. And when I say very clean level, I mean that the one person that I do ask, she's a very good friend of mine. I know she knows how to find the answer. She can find resources for everything, okay? She's very good at that. So she claims she doesn't know everything. I feel like she does, because she's always helped me, or she can help me to see it in a different way. Or I'll come to her and I'll say, hey girl, look, I saw this. I think it's this. And then I'm thinking it may be this. So can you help me? Then she of course, she knows that I've tried to find the answer on my own. That's the thing. That's the key. And then it's just like, oh, well, I would think it's this, this, and this. And then she'll explain to me how she got to that. or she'll show me where she found her reference at, and she finds references really quick. So yes, I always want to encourage you guys to just look into resources. Try to find as much out as you can, all right? Because it's only going to be better and easier for you, okay? And if you see somebody struggling, help them. Give them a hand up. But make sure that they're trying to learn at the same time, and they're not just sitting there trying to ask you, what is the answer to this? Okay? So just my advice. Now, I will be posting the Answer Monday episode at 1 p.m. Central Standard Time on Monday. I will see y'all then. I'm very excited for this coming Friday's Quiz Friday. And it will be in the community tab, posted in the community tab on Friday, okay? Quiz Friday will, again, not be filmed. It will be written in the community tab. And if you have any questions for Q&A Tuesday, let me know. I'm still stockpiling questions. All right, so I will go ahead and wrap this on up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. Okay, I will see y'all on the next episode. Bye.